Today's video, we're going over what to do when you've got hip pain in the squat. Now, when your patients have hip pain in the gym, usually the biggest culprit is going to be squatting. The only other movement I can think that creates hip pain to the same degree as squatting is going to be a sumo deadlift. So if you have a patient that loves weight training in the gym and they can't squat, that's a big problem because a squat is one of the most important exercises in the gym. And if you're a patient that competes in powerlifting, Olympic weightlifting, the squat is incredibly important. So in this video, what we're gonna do is teach you how to modify the squat so your athletes can keep working towards your training goals without aggravating their hip pain. What's up, guys? My name is Dan Pope from fitnesspainfree.com. I'm a physical therapist and a coach. We have helped to make thousands of incredible clinicians through our online courses, communities, and mentoring programs. The goal of today's video is to make you 1% better. Now, when you have a patient, we have to make sure we do a good job diagnosing what they have so we can treat them accordingly. However, if you don't modify the squat along with the rest of the treatment, you might not make progress. The big pathologies that have pain in the bottom of the squat are going to be femoral acetabular impingement syndrome. You might also be dealing with some hip arthritis, and sometimes gluteal tendinopathy hurts in the bottom of the squat. You might also be dealing with an athlete that has hip dysplasia with associated hip labral pathology. All right, so the first thing we can modify is going to be the load. So obviously it's very easy to take some weight off the bar, right? A few creative ways you can take the weight off the bar and still work towards your training goals is by messing around with the reps in reserve. So if we add a few reps in reserve, so essentially we're not going to absolute failure, RPE 10 out of 10, but more like a 7 out of 10 RPE. You're knocking some weight off the bar, you're still getting stronger, right? But you're not aggravating the hip, right? The other thing we can do is we can increase the reps. So if you increase the reps, so let's say you're going from a 5 rep max to a 10 rep max, you're naturally going to reduce some weight off the bar and it might feel really good for your patient, right? The other thing we can do is you can mess around with tempo or how fast the athlete is performing the movement. Let's have you, Trinity, take the bar out of the rack, step forward a little bit, make sure you don't hit those J hooks. And what we'll do is a tempo squat. We're going down over the count of 2 and then coming up over the count of 2. Let's go ahead and give me a squat nice and slow. 1, 1,000, 2, 1,000, and then right back up again. 1, 1,000, 2, 1,000. Let's do it again, a little deeper this time. 1, 1,000, 2, 1,000, up again. 1, 1,000, 2, 1,000. Very good, and pause for a second. This looked great, but the other thing we can do is add a pause. Anytime that you slow things down or add a pause, you have to drop some weight off the bar. And if you're dealing with an athlete that's load intolerant, let's say that they start to hurt once the load gets above 80% of the 1 rep max, if you keep it below 80% of the 1 rep max by slowing things down or adding a pause, we can still build their squat a little bit. So this next rep, let's pause at the very bottom. So going all the way down, slowly and under control. Yep, go for it. Pausing for 2 count, 1, 1,000, 2,000, and right back up again. Yep, and let's back up and put it back in the rack. And what's kind of nice about this is that if you pause in the bottom position of the squat, this is going to help build the bottom position of your squat, which most folks, when they're trying to get stronger, they're weakest when they come out of the hole. So if this feels really good, it's a great way to continue working towards your training goals and respect that healing hip. The next easy modification is just widening the stance and adding a little bit of extra toe out. So go ahead and go a little bit wider with your stance here, Trinity, and add a little extra toe out, right? And let's go down to the bottom of the squat and pause down there. Yep. And as you can see, the knees are out a little bit wider. Right? You can come right back up again. So in folks that have femoral acetabular impingement syndrome specifically, but also the same for gluteal tendinopathy, as they go down to straight plane flexion, you start to run out of room in the hip joint, you get some compression of the ball up against the socket. This is all normal, but if you have FAI, it can become painful. If you go into a little bit of external rotation, abduction, it clears some extra room in the hip, and usually this feels quite a bit better for your patients. So a good thing to try. Modification number 3 is shortening the range of motion. So largely, can you show me a full range of motion squat here, Trinity? Yep, all the way down. Most folks that have FAI specifically will have pain towards the very bottom part of the squat. Let's go another rep for me here. Trinity, just don't quite as deep. Then right back up again. Does it feel a little bit better when you stay more shallow? Does help quite a bit. So obviously you can have your athlete shorten up that range of motion. The other thing we can do is we can add either a box, or what I like to do is add a ball. So we can give a target essentially for Trinity to hit, just because we want to be consistent with the range for every single repetition. So go ahead and do a repetition, just tap your butt lightly on that ball and come right back up again. How's the hip feel? Good. And that way we know that we're not going too deep on any of the repetitions. We're very consistent. Good, take a breather. And if you like squats but you don't like hip pain, then you should like this video because it helps me out. Next, we can tinker with how upright the torso is. So essentially, we're gonna have Trinity here perform a back squat where she's really sending her hips back aggressively and then pause at the bottom. Let's go ahead and show that for me. Good. Yep, and you can see there's a lot of bending at the hip. The hip's in a lot of flexion. Come right back up again. Let's perform a very upright squat, allowing those knees to come forward, right? So go ahead and do that and then pause at the bottom for me. And you can see there's much less hip flexion here. So largely, the more hip flexion you go into, the more strain goes on the hip. The more you send your hips back, the more strain goes on the hip. So if we can get a little more upright in our squat, it tends to feel a whole lot better, right? Let me show you next in a back squat. Trini, let's go ahead and grab this bar. We'll step forward, we'll do 1 or 2 reps, and then we'll show a front squat afterwards to compare. From here, sending those hips back and nice and deep, pause at the bottom. Good, and then right back up again. Good, let's go ahead and rack. Next one we'll show is going to be a front squat. So in the front squat, the bar is going to be in the front rack position, which naturally keeps your torso a little bit more upright, which should reduce some of the strain on the hips. So go ahead here, Trinity, on racking, walking forward. From here, stay nice and upright, drive those knees forward, keep your chest up, heels down, and right back up. And it's pretty easy to see there's just much less hip flexion, but you're still hitting that same depth. Another nice variation you can try with your athletes with hip pain is a goblet squat. And this is nice for 2 reasons. So when you have a weight in front of you, it's going to keep you more upright. So it reduces some of the compression in the front of the hip. The other piece is that holding a goblet here is harder than putting one on your back. So we tend to reduce the load of the squat just by having the implement in front in a goblet position. So go ahead and grab that dumbbell here and stay nice and upright and keep the dumbbell a little further out in front of you. This provides a bit of a counterbalance, so Trinity can stay nice and upright. So go ahead and squat for me, Trinity. Yep, and you can see there's not a ton of hip flexion here either, so a really good example. And the last thing you can mess around with is going to be a heel lift. Now, we were just talking before we started filming here, is that Trinity has good ankle dorsiflexion range of motion. So she has a lot of options in terms of squatting upright or setting the hips back. Some folks don't have that. They don't have great flexibility. So in order to grant extra flexibility and stay more upright, you can just elevate the heels. So go ahead and stand on this, Trinity, right? And then from here, stay nice and upright. Show me a very upright squat here. Good. And right back up again. So what's really nice is that we can use any of these modifications to reduce some of the stress on the front of the hip so your athletes continue training. So when folks have hip pain, usually going deeper into the squat causes more and more discomfort, right? So imagine this is the socket portion of the ball and socket joint of your hip, and this is the ball. As I go into hip flexion, so as I'm descending to the bottom of the squat, what ends up happening is you can get some contact of the ball up against the socket. So the deeper you go, the more contact that you get. Now this is normal usually, but in folks that have irritated hip joints, the deeper you go, the more contact you get, the more compression you get, the more painful it is, right? And essentially, we don't go down as deep into the squat, we don't have as much contact, it feels pretty good. Another thing we can do is we can change the socket orientation. So essentially, I have ball and socket joint right here. This is going to be the socket, this is going to be the ball. So I can go a little more shallow into my squat, because if I go really deep, it adds a lot of compression. Or one of the things I can do is I can change the orientation of the pelvis. So if I go into a posterior pelvic tilt, that's also going to clear a little bit more room for the hip and allow people to squat more comfortably. Now I want to show Trinity here. Let's have you face this way and then go into a quarter squat. What I want you to do is have your arms straight out ahead. Go ahead and squat and go into an anterior pelvic tilt. So let's pause at the bottom and then go into an anterior pelvic tilt. So she's really trying to extend her low back. What that does is brings the socket down into the ball. Let's go into a posterior pelvic tilt. So squat all the way down and then posteriorly tilt from here. What that does is moves the socket away from the ball. So usually, let's have you stand up here, Trinity. Let's go into a slight posterior pelvic tilt at the start, right? Maintain that posterior pelvic tilt and do a full rep for me. You ready? Let's go ahead. Neutral, posterior, there you go. Maintain that as you squat and then right back up again. Yep. And what might be nice is that just changing this angle at the pelvis, this is particularly nice for folks that are very extendy. So folks that already have a big anterior pelvic tilt, you just get them to neutral. You don't always have to get them into a posterior pelvic tilt. Sometimes that creates problems elsewhere. They might be able to squat much more comfortably. Another thing to correct, particularly if you're noticing that this is creating pain in front of the hip, is going to be early hip rise out of the hole. So essentially, if I go to the side here, what you may see in a lot of athletes, particularly as they get to their heavier sets, is they stay pretty upright in the squat. As they come out of the hole, they end up shooting the hips back and up as they come up out of the hole, right? And generally speaking, this is a strategy to use those stronger muscles of the hip as the weights get heavy and the athlete doesn't have the leg strength to get out of the hole, right? So what we want to see is when the athlete's coming out of the hole here, their hips and their chest rise at the same time, right? So that's one of the first things you can cue. The second piece is you don't want to have the knees come in out of the bottom of the hole in the squat. So if I'm coming down into the hole, things look good. If As they come up out of the hole, knees come in and then right back out again. It increases some compression on the front portion of the hip. Think about doing a failure test. You have flexion, adduction, internal rotation. That's the same thing that's going on in the bottom of the squat. So you correct those two things, can reduce some of the strain of the hip, allow athletes to squat comfortably. And oftentimes you're gonna have to knock a little bit of weight off the bar because the reason why they're compensating is because the weight's too heavy. All right, so now you have patients come through the door with hip pain, you know exactly what to do. Trouble is, there's something that's a little bit more common, low back pain. And tell you what, folks have low back pain, the squat usually doesn't feel good either. But I have a video for you, put a link in the corner there. Go ahead and click on that. I'll teach you what to do when your patients have low back pain in the gym and they're trying to squat. I'll see you there.